Our deepest motivation is that we want to be able to provide proper healthcare to as many patients as possible. This is becoming a challenge since our healthcare system is heading for a healthcare crisis.
Many patients receive chemotherapy through cassettes. This needs to be connected to a so-called CAT pump. The current process is that the doctor's assistant needs to arrange a pump through home care for every patient. The pump is connected in the hospital and the patient goes home to complete the treatment. Once the treatment is completed, a home care nurse needs to go to the patient's house to disconnect the system and to return the pump. We want to change this process. We want to administer chemotherapy, where that is possible, through an elastomeric system. This elastomeric system does not need to be connected to the so-called CAT pump. So we think that by changing this process, we don't need a doctor's assistant to arrange a pump for every patient. We think we will receive less phone calls by anxious patients. And we also want to teach the patient to disconnect the elastomeric system on their own.
Elastomeric pumps are made by our chemotherapy robot. We will give our patients the same treatment, but it is less manual work for us.
In this project, the patient is in the lead. This leads to more patient involvement, more freedom for the patient, and leads to patient empowerment.
There will be no more phone calls of anxious patients due to beeping systems at home. There won't be healthcare nurses involved in uncoupling pumps and spending time on that. And very importantly, that our patients will be more free and more at home and less in the hospital.